welcome to Therapy Chat with Phoenix Behavioral Health. My name's Dr. Parks, and with me today I have Christine Delorier, who is a licensed independent social worker and also certified in alcohol and drug abuse treatment, and also licensed in alcohol abuse and drug treatment. And today we're going to be talking about early recovery from alcohol or drugs, drug misuse. And it's a process. It's not easy. That's why we call it an addiction. And so today we're going to be talking about some of the common signs and symptoms that we see when a person is in early recovery, which is typically considered the first 12 months. So, Christine, I know that you have worked with a lot of clients who are in the process of becoming sober, or midway, or coming up to perhaps their first year of recovery. What would you say are some of the most important things to consider when working with a client and at this point?
Thank you for having me here today.
You're welcome.
I think one of the biggest challenges for people in early recovery is not realizing the different stages of early recovery. People think usually that if they detox, then they're kind of good to go. But really, detox is just the very first part of the recovery. It's the physical part that can last anywhere from a couple of days to a couple of weeks. But the challenge is the real recovery part. The real process starts after that, because that's when the brain needs to recalibrate. And that can take months and sometimes even up to a couple of years. So there's a lot of challenges in early recovery that people need a lot of support with that I think aren't really realized or talked about.
Yeah, I think that oftentimes a client will go into detox, which is just for a few days, and then, as you said, feel that that's it, and now I'm on my own. And it's really critical because in the early stages of recovery, it's so important to have that support and to be able to have someone to talk to, ideally a lot of supports, because that's when we see a lot of relapse, especially in those early months, right?
Correct. Yes.
Do you find that a lot of your clients who are in early treatment also present with other mental health issues?
Yes. I think it's very common for people with substance abuse problems to have issues with depression, to have issues with anxiety. And I think quite often there is a lot of trauma issues that probably aren't even connected. The person isn't connecting that or realizing that they have it, but once in treatment, that tends to come out, that there's been some early life trauma that they've gone through, and that very well can be something that's medicated by substance abuse.
And I just want to throw one thing in here too, that if someone is at the point where they're feeling that, I may have a substance or alcohol treatment issue, it's really, really advised to make sure that you go to someone who works with substance abuse and addictions, because certain drugs that we are trying to stop using, such as alcohol and other categories of drugs, really need a kind of a medical detox to make sure it's safe, right?
Yes, yes. Alcohol and the benzos are particularly dangerous to self-detox from.
Yes. And benzos are things like perhaps for helping people with anxiety, sleep issues.
Yeah, the Valiums, the Xanaxes, the sleeping pills, those are all in that category.
Okay. So when a person begins early recovery, oftentimes they'll, not everyone, but a very high percentage of individuals will experience what's called post-acute withdrawal syndrome, or PAWS. And if you look now at graphic 1, there's a list of some of those more common symptoms that we're likely to see. Foggy thinking and trouble remembering. I don't know what your experience has been with that, but I know I have a lot of clients who'll come to me and they'll say, I've not been drinking or using for a few weeks now, but I'm forgetting everything. I forget where I put this. I forget what we just talked about. I forget something that I just read. I don't have that clarity of thought. Is that something that you see frequently?
Yes, I've seen that, and I've also had clients come in very worried that they're getting early onset dementia because they're having all this foggy thinking, and it's all part of the process of the brain kind of recalibrating and clearing up, and that takes time.
Yeah. So having patience, because if a person doesn't know that that's part of the recovery process, I've heard often when I've worked with individuals or groups, people say, I actually feel worse than I felt when I was engaging in this. So it's something that could be very uncomfortable, but does pass.
Yes, I think all of these symptoms that we're going to be mentioning, I think it's important to remember that all of these uncomfortable feelings, anxiety, depression, anger, all of these things that we'll be touching on, they do pass. Right. And I think one of the hardest obstacles for people that they struggle with substance abuse issues is their inability to tolerate uncomfortability. Everything has to be immediately medicated, immediately obliterated any uncomfortable feelings. Right. And the challenge in recovery is realizing that you can sit through those, get to the other side, and not only will it be better for you, but you're going to be stronger emotionally for doing that. But that's the challenge. That's the scary part for people in recovery.
And of course, we see urges and cravings to use, and they kind of come just out of the blue because that's the best way to pull you back. So urges and cravings could very easily be triggered by a whole lot of situations. It could even be that it's someone's birthday, or perhaps the anniversary of someone that you lost, that you loved, or it could be a certain piece of music, or a place, or the weather. I mean, so many
dreams.
Dreams, yeah.
Usually, there's very vivid dreams in early recovery. That's the brain kind of refiring and getting back its REM sleep, and you can wake up and find yourself having cravings as a result of very intense dreams.
Right. Irritability, hostility. A person may find that their mood changes are very dramatic and very sudden, and it often feels like you're on a roller coaster. I feel really depressed and low energy, and now I feel great, and now I feel angry. So a lot of mood changes as well, because what we're looking at is when there's prolonged use of a substance, that has an effect on the wiring of the brain. And so even though we've stopped using that substance, we're also looking at a physiological process that's happening. So we have to give it time for things to get back into place and functioning normally. And so there's like that start until everything starts to move more smoothly. You mentioned nightmares, sleep disturbances, fatigue. Another one might happen a little less frequently, but some people experience physical or motor disturbances, kind of like walking into a table or tripping up, just not having that fine motor coordination that we can see. Anxiety and panic.
Yes,
You
a lot
see
of
a
panic
lot?
attacks can come in. Perhaps you haven't even had them before in your life, and all of a sudden you find yourself having panic attacks, which can be very scary, and sometimes they can be confused with having heart attacks, and people will go to the emergency room thinking they're having a heart attack when it's really a panic attack.
So there's quite a few symptoms up here for viewers. And there may be other things that you experience too, but these are probably some of the more popular, more common things. So another point that I think is important to make is that, substance or alcohol misuse or addiction doesn't kind of exist in its own little space. There's a really big interaction between other mental health issues that may have been there before, or maybe created from the addiction. So it's important when you are seeking help that you make sure that your therapist is qualified both in mental health and in addiction counseling. That's a really important point to make, I think. Okay. Moving on, there is a medication-assisted treatment that's available, sometimes referred to as MAT or MAT. It may be something like Vivitrol or Suboxone or Camprol, all of these things. Do you have any strong feelings about how to and when to and how long to use any of these medication-assisted treatments?
I think all of that has to be done in conjunction with the medical professional and to get a piece of that coordinated as well. My personal feeling is, drugs like Suboxone and methadone and Camprol's more of an anti-craving kind of drug, or Vivitrol kind of blocks the craving also. Those drugs, I think, can be very useful on a short-term basis. I think people who have struggled several times with getting sober. Maybe they've gone to a series of detoxes 2 or 3 times in the past, and they just can't seem to make it more than a very short period of time without picking up again. These types of supports can be very helpful to them to kind of get them over the hump of the early recovery and get them into process where they can get more supportive services. I think personally, I feel it shouldn't be something that you're on forever. I think there should be a goal of getting off of it and not just relying on it. Because I think if you're working a very solid recovery program, there shouldn't be any need for it. Right. But it certainly can be useful through the first year of recovery if you need that extra support, if you've struggled. Not necessarily for the first time someone comes in, but maybe if they've tried it a couple of times and they're not having any luck, it can be a key to helping them gain some very good recovery.
Right. And I think, as you said, medication-assisted treatments really are designed to be used in conjunction with therapy as well. Sometimes I'll say to my clients, if you broke your leg and you put a cast on it, right, you're not just going to get up the next day and start walking, even if you really want to. You have to go through physical therapy, right? You have to strengthen that. And it's kind of the same thing with addictions. It's a process. It's a long process, and in the process, using something such as a medication-assisted treatment can help as you're working on all of the other issues underlying the addiction and making those behavioral and thinking cognitive changes as well. I think another important point too is the family, right? Or if close family, close friends, often don't have a lot of knowledge about what to expect when their loved one is in treatment. How do you feel about including the family for an individual who's in treatment?
I think it's essential. I always try on some level to have at least sporadic meetings with family members, because I think it's a very good way to sort of make sure that everybody is on the same page in terms of the treatment and how things are going. I might be seeing one thing in therapy with the person, but the family members may be seeing something entirely different at home.
Right.
So it's good to periodically touch base and make sure that everybody's on the same page. It's also essential, I think, for family members to get support as well, and often they don't. And very often, family members also come from homes where they grew up with addiction, and there's a lot of unresolved feelings with that and trauma, and that impacts the person that's in recovery, and inadvertently they may even sabotage that person's recovery. And I think it's really important that all family members get support, because this is a family disease. It's not just an individual disease.
What I often see is, an individual goes into treatment, and once they've done their inpatient treatment, typically the next step would be what's called an intensive outpatient program, where the individual will go 3 times a week, probably for 4 weeks, sometimes 8 weeks, and then step down to an early recovery group and continue that therapy. But often the family members' expectations are not really accurate. So they're supposing that the individual will go into treatment and come back and be completely back to normal. And so there's a lot of changes that happen, and if the family is not aware of what's going on for the individual in treatment, as you said, that can make things even worse, more difficult, that can potentially lead to more likelihood of relapsing again.
Yes.
So what are some things that a client can do who has gone through the first stages of treatment, of detox and the inpatient treatment, and as you see on graphic 2, there is a list. There are more things, but these again are some of the most important things. And number 1 is really, you want to set yourself up to succeed. So having a really good support system is really important. So making an appointment with a certified, licensed mental health counselor / drug abuse, drug addiction therapist is number 1, to make sure that that person is helping you get on track. Self-nurturing. I personally see that frequently is a very difficult thing for a lot of clients. Do you see a lot of that?
Oh, definitely.
Yeah.
I think it's really important that when you come into treatment, that you kind of try to have a mindset of progress, not perfection.
Right.
And I think a lot of people come in and they put high expectations on themselves, and there's so much adjustment going on. You're going to have good and bad days. You're going to have days where you feel like you're failing in your recovery, and other days where you're going to feel like you're doing it perfectly. So you've just got to kind of realize it's a process. And it's very important to have a support system in your recovery, and that can be various things. It can be, probably the most common thing is AA. Everybody thinks of that. That can be a wonderful program. It helps a lot of people. I know also a lot of people are somewhat resistant to that. But you put in something else, maybe a spiritual program if you're religious, or meditation. Diet is very important in recovery. One of the biggest things, I think people tend to skip meals, or they eat the wrong things.
Right.
That can contribute to feeling sluggish and to potentially to relapse. So that, you know, and of course friends, loneliness. A lot of people that come into recovery, all their friends have been heavy drinkers or drug users, so now they find themselves somewhat isolated. So that is a big factor too. So there's a lot of dynamics that I think are very important that have to be considered in recovery, and you really need to have a varied support network, and a therapist, a doctor, as well as a support group, and supportive and family members that are also being educated that on this whole process that usually they don't understand either.
Right. I think, you know, when oftentimes, in fact, probably most times with my clients at least, we'll do what's called a functional analysis, where a client will actually try to pinpoint a trigger and then back up a little bit and see what was leading to the trigger. Right? And then we can review that and say, okay, so when that trigger happens again, now what can we do differently so that we don't repeat that same pattern? Because when we're talking about alcohol or drug misuse, it becomes a pattern, a habit, right? And it's hard to change habits. So by doing that, we're helping a client become more aware of what's going on and leading up to those behaviors as well. This is a big one for me. A client learning how to use downtime. That's probably something that you see a lot of too, right?
Yeah, I think a common pattern with people with addictions is all or nothing behavior.
Yeah.
And so what you see that in their drinking and drugging. All or nothing, they kind of go full tilt, or they don't do it at all. And that can also be in their off time. They tend to be overworkers, where they'll be workaholics, and that has to be, balance has to be introduced into the equation.
Right. So, as you see from this graphic, these are some of the main things that we want to consider, because early recovery, as we said earlier, is a process. It takes time, and when we look at when most relapses happen, it's most frequently those first 3 months, but definitely in that first year, it can be very easy to be triggered and to relapse. And the important thing, if we do relapse, is to get back on track straight away, as soon as possible. If any viewers would like more information, or you have any questions about that process or about getting help, you may have family members or close friends who may have be struggling with some kind of addiction. How do I get help? What's the first place? Who are the contact peoples in the area? Please give us a call. Our number is 508-623-3931. Or you can email any questions that you may have, or any requests that we explore certain topics. Thank you for joining us today. We look forward to meeting with you next week. And thank you, Christine.
Yeah, thank you.
Thank you.